Hello students, we have done with ENTD and now we continue with dental cases. Let us start with dental anatomy. When we start with definition, it is a field of anatomy dedicated to study the naming of teeth and the structure of which they are made. The term dentition is used to describe the natural teeth in the jaw bones. Primary dentition is the first set of 20 primary teeth and also referred to as baby teeth or displaced teeth we call. It is from 6 months of age to 6 years. Permanent dentition refers to the 32 secondary or adult teeth after these primary or displaced teeth are shed. And there is also mixed dentition, which occurs when the both primary and permanent teeth are present, and usually between the age of 6 to 12. The other term is eruption, and which is a movement of tooth through the surrounding tissues so that more of the tooth becomes visible in the mouth, whereas exfoliation is a process by which the roots of baby tooth are resorbed and dissolved until the little root remains, until the baby tooth falls out. When we see the development of teeth development is a complex process by which teeth from embryonic cell grow and erupt into the mouth. The development of teeth starts intrauterine and intrauterine life, and the primary teeth start to form between 6 to 8 gestational age, and permanent dentition start to form on the 20th week of gestation in utero, in the uterus. When we see the details of anatomy of teeth, dental arch have two arches, maxillary, the upper arch, and mandibular, the lower arch. Maxillary arch is actually part of the skull and fixed and not capable of movement. Okay, it has no joint to be mobile, and the teeth in the upper arch are set in the maxilla. Okay. Mandibular arch is capable of movement through the action of temporomandibular joints, joints that connects mandible and temporal bone of the skull. The mandibular bone supports the teeth in the lower arch. The primary teeth typically erupt in the following order. When we see eruption of teeth after delivery. This is after delivery or after being born. Central incisor, first eruptus, and then lateral incisor, first molar canine, second molar, then follows. These are incisors, central molar, lateral central incisors, lateral incisors, canine, premolars, and 3 sets of molars. This is order of eruption of primary teeth. Then mandibular teeth, eruptus, before maxillary teeth. As you know, the lower group of teeth eruptus first before the upper arch teeth. Teeth erupt sooner in the females than male. This is order of eruption. Central incisor. The lower is first to erupt, 6 to 10 months, then followed by this one. This upper one. This is order of eruption in permanent or adult it is after the primary, or childish, okay, baby it is shade, and this permanent it is follows in this order. Okay, good. So anatomy of teeth, when we see the oral cavity, okay, we have already saw it, okay, in the throat anatomy. The tooth is made of three elements, okay, water, organic materials, and inorganic materials. This is the previous classification that we have already seen. Okay, this is incisor. This is how to identify, okay, fallen tooth. Okay, this is incisor, canine, premolar, and molar. Canine also said to be cuspid. Okay, has one pointed sharp. Okay, because the function of canine is to tear. Okay, it tears. And premolar is bicuspid. Okay, has two pointed sharp, okay, pointers. And premolars and molars usually have grading function. Okay, this is upper arch, maxillary arch, and mandibular or, okay, lower arch. Okay, this is 32 set of, okay, total it is 4 incisors, 1 canine, 2 premolars, and 3 molars. The same in the mandible. When we see the parts of tooth, each tooth in the mouth contains 4 different tissues that serve different functions. The teeth are made up of, okay, 2 major parts, crown and root. The crown of tooth is what's visible in the mouth, and the root is portion which normally not visible in the mouth and anchored within the bone. The 4 different tissues that are present in tooth is enamel, dentine, the pulp, and the cementum. Okay, this is crown of tooth, and this part, okay, this part is root. This external layer is enamel, and followed by, okay, dentine down to here to the root. This is a pulp down to the root, and this is cementum, okay, only in the root. This is cementum, which anchors the root of tooth to this bone, to the mandibular or maxillary bone, alveolar bones. Enamel makes up the protective outer layer of the crown of tooth, and dentine make up majority of inner surface of the tooth, and it cannot normally be seen except on the X-ray. Pulp, this is area inside the tooth that holds the nerves and, okay, blood vessels of tooth. It is in the center of tooth and is in the both crown and root of tooth. Okay, both dentine and pulp, okay, goes deep down to the root. Cementum makes up outer surface of the root of the tooth, and it is much softer than enamel. Okay, this is previous picture. the supporting structures of teeth is that is periodontum is defined as supporting tissues of the teeth include surrounding alveolar bone, maxillary or mandibular, the gingiva, periodontal ligament, outer layer of tooth roots, that is cementum. Okay, these are supporting structures of teeth. Okay, this is the cementum of teeth. Here is gum and bone. The alveolar bone, the right and the left maxillar bones together, the alveolus, and each alveolus is lined with thin compact layer of the bone seen on the X-ray as lamina dura. Tooth root surface are covered by a thin layer of cementum, and the other supportive structure is periodontal ligament, that we call it PDL. This periodontal ligament is very thin ligament composed of many fibers that connect the outer layer of tooth root, okay, with thin layer of dense bone or lamina dura lining each alveolus or tooth socket. The fourth surrounding or supportive structure of teeth is gingiva. It covers the alveolar process of the jaws and surrounds the portion of teeth near where the root and crown join. The gingiva is only visible part of periodontum that can be seen in the mouth during oral examination. This periodontum has different structures, including the ligament, okay, inner structures, and the gingiva is a part of periodontum which is visible in the mouth. We call it also gum, okay, gingiva or gum. The final portion of anatomy and physiology of teeth is numbering system. There are three numbering systems: universal numbering system, Palmar tooth notation system, and World Dental Federation or International Numbering System. The commonly used universal numbering system as numbers 1 through 32 for the teeth in the permanent dentition. It starts with 1 from maxillary right third molar. Okay. This is right third molar. Okay, the numbering, universal numbering starts first from here and continues in this arch. Okay, in the same arch in left mandible and then right mandible in this here to 32. Okay, this is all about anatomy and physiology of dentistry. And thank you.